the way back to COVID-19, ground zero. Was there a cover-up? From the wet market all the way to government, her shocking story. When it really began.
The authorities in Wuhan haven't been honest with the world.
That has been covered up.
A Sky News Australia special.
More than 50,000 people are dead and thousands more are fighting for their lives. COVID-19 is a near unstoppable killer. The virus has ravaged nations, devastated economies, turned bustling cities into ghost towns. No nation has escaped its destructive grip, and it appears the worst may be yet to come. But could all of this have been avoided? Could the coronavirus pandemic, which has upended all our lives, have been prevented? Tonight, Sky News can reveal new information which suggests Chinese authorities knew about the virus much earlier than they've admitted. Those inside China tell us this information was deliberately withheld. That the communist government is continuing to lie about the coronavirus's impact, and that the deaths of thousands of people may have been covered up. We'll also take you around the world and hear from experts and those living in the COVID-19 hotspots to explore how the nations most affected responded to the pandemic. What's worked, what's failed, what's likely to happen next, and how we win this global war. Factories are back up and running. And construction workers are back on site. Life, it seems, is returning to normal at the birthplace of COVID-19. The lockdown of Wuhan in China has been loosened. It'll be lifted on Wednesday, and authorities there are celebrating what they see as their successful battle against the deadly virus. But we're now learning just how irresponsible they've been. The cover-ups and the apparent disregard for human life, which may have led to the deaths of thousands of people.
We could have been better off if China had been more forthcoming.
The virus, now known as COVID-19, was believed to have originated in this Wuhan exotic animal market, transmitted from a bat to a human. It spread like wildfire. Hundreds were infected within days. Doctors who tried to alert authorities were harassed and ignored. Some have even disappeared. The Chinese government claims the first coronavirus case was identified around December 31. But official documents indicate that's an outright lie.
From the classified government record that we have seen, what we have found is that there are actually cases in November.
Investigative reporter Josephine Ma says the classified documents she's seen state Chinese authorities knew of a case of an infected 55-year-old from Hubei province on November 17. That's 6.5 weeks before Chinese Communist Party leaders alerted the World Health Organization. During that time, hundreds were infected.
Before 20th of January, there was like cover-up, of course. From the information we saw, in 2019, there were already over 200 cases.
The infamous lockdown of Wuhan then came much too late. The horse had already bolted. The virus surely would have spread beyond the city of 11 million and likely beyond China's borders.
From my research, there was actually 5 million people in the Wuhan area where the centre of the outbreak was that had left in the 2 weeks before the lockdown there. So if you think about those 5 million people, they have gone all around the world and they have just spread the illness.
And residents of Wuhan say there's another cover-up going on. The government claims around 2,500 have died here. But records of hundreds of deaths may have been kept secret. Wuhan social media users say all 7 of the city's funeral homes have been delivering hundreds of urns each day.
One Chinese media report talked to a truck driver, and that driver said he has delivered 5,000 urns to that funeral home, and that is one of the 8 funeral homes in Wuhan. And 5,000 alone is much bigger than the official number of deaths.
And stunningly, Wuhan's wet markets, which experts believe are a breeding ground for potential viruses, are still operating.
It boggles my mind how when we have so many diseases that emanate out of that unusual human-animal interface, that we don't just shut it down.
We do know that there are laboratories researching coronaviruses within just a few miles of that food market. Now, the Chinese Communist Party is going to great lengths to conceal what happened in those laboratories.
By fudging figures and lying to the world, some have argued the Chinese Communist Party is to blame for the incredible spread of this deadly virus and the deaths of tens of thousands of people.
If you look at the British government's response, a number of senior politicians have said China's day of reckoning needs to happen very quickly with regard to this virus.
The virus soon crossed a continent. 8,000 kilometres from Wuhan, COVID-19 wrought chaos. An Italian returning from China is believed to have brought it to the north of Italy. Doctors reportedly misdiagnosed dozens of patients who had the virus. And in a misguided attempt to prevent racism, and despite the obvious risk of coronavirus spread, the mayor of Florence declared a Hug a Chinese Person Day. Groups in Milan did similar stunts.
No, un abbraccio, benissimo, grazie.
A regional lockdown was later declared. It failed miserably as panicked residents defied orders and travelled south. COVID-19 spread across the country, killing at least 11,500 people.
The age profile of their population, there's 23% of the Italian population is over 65. And so when they have had an outbreak of this size, their larger age population is the reason why that some of this death toll was actually up to 10%, whereas Germany's is on current figures about 0.6%. The other factor that I think is been underreported is in Italy, there are just far too few tests. They have more people in the community that actually have this illness than what they realise. And I've spoken to doctors in Italy where they're going around doing home visits to COVID-19 patients. They actually have had to don full protective gear to actually go and check that those people have the oxygen they need. And they're saying that, to me, that there is no way the numbers are real because they must be much higher. Because only people who get to hospital are being tested.
This small-town parish priest deals with death on an industrial scale.
Non sapevano più dove metterle.
Authorities no longer knew where to put the coffins. The saddest thing is that these dead were put so naked, so alone.
For 5 weeks, Rome's streets have been empty. There's barely a soul at its centuries-old landmarks amid the government-ordered nationwide lockdown. School teacher Marzio Toniolo watches the Pope's addresses from home these days. His mum and dad are nearing 90 and a pandemic is at his door. Marzio's prayers are pretty simple.
The situation isn't that great. We are just thinking about surviving.
The spread here appears to have slowed, and the statistics suggest the country may already have passed its peak of COVID-19 cases. Italy illustrates the dangers of late, uncoordinated and localised measures.
I think what it highlights is that we need to think about elements of national coordination in when you are responding to outbreak, alerting and enhancing your surveillance system early on throughout the country, activating all mechanisms that bring together a strong outbreak response.
Where Italy failed, South Korea excelled. The nation, right on China's doorstep, is one of the few seemingly winning the war against COVID-19, going from 900 new cases each day to around 50, all without locking down cities. The success is all in the preparation and testing. South Korea boasts the world's most expansive, well-organised system.
It spans everyone from sort of mild symptoms to more serious symptoms in folks who've been in contact at various degrees to infected people.
At least 300,000 people have been swabbed in medical centres, their cars, and even revamped telephone booths. The government learnt the lessons from the 2003 SARS and 2015 MERS outbreaks.
They learnt lessons that were absorbed within the country and were used to strengthen their health system. They also had very good and clear communication from the government, so twice daily briefing to the community, which helped the community understand the scale of the outbreak.
Experts credit Singapore's tracking system with its impressive numbers.
Singapore has been one of the more successful models for dealing with the pandemic, and the primary kind of strategy for Singapore has been to trace and isolate. So from the beginning, there's been a large team of people in Singapore responsible for finding the people that are sick, for doing the contact tracing, isolating close contacts of infected people, and just making sure that the chain of transmission stops.
Publicly available databases list the number of cases and basic details of patients, and local maps show where the coronavirus clusters are.
So from the beginning, Singapore's approach was to put all of that information out there so that people know the extent of the spread and can understand and grasp the nature of what's happening, in the hope that that would result in calm rather than panic, and to an extent that's worked.
Experts predict South Korea may be the first Asian nation to become COVID-19 free. France is in lockdown. Its health system simply can't cope with the coronavirus's incredible spread. 4,000 people have already died here. Firefighters were ordered to help overstretched ambulance crews. And by chopper and train, critical patients are being moved to hospitals outside the country. Medical intern Elodie Vieira has been thrust onto the front lines.
It's something out of the ordinary, so we're never ready for this. But we have no choice. It's part of the job and we're here to help. We do what we can.
It's not clear why France was impacted so severely, or if anything could have been done to prevent it reaching such a scale. French officials declared shutdowns relatively early, yet still allowed municipal elections to go ahead in March. The situation is likely to get much worse before it gets better. The countrywide lockdown Australia has so far avoided was enacted in the UK a week ago.
From this evening, I must give the British people a very simple instruction. You must stay at home.
3 days after that address, the PM himself tested positive for COVID-19. The British public kept calm, carried on, and have been a little creative while stuck at home, with social media challenges and street dances.
It's not unusual to see me cry. I wanna die.
Life in lockdown in London is extraordinarily boring, but also a little bit frightening. Every day we're watching new numbers come through of the death toll, and it's really hard to get your head around just how many people have been affected.
The lockdown replaced the British authorities' initial plan to do partial shutdowns so the country could develop a herd immunity. Some experts say the current measures aren't strict enough.
The airports are still open and flights are inbound from places such as Italy, Spain and China. So big questions are being asked to Boris Johnson, which suggests, why are we, the British people, in lockdown, where seemingly people are arriving every day, not being tested in the airport, and then walking into the country, potentially bringing the virus in?
Temporary hospitals have opened in several UK cities.
Looks like we're going to have a very busy few months. At the minute, we've breached our capacity in intensive care, so we've got over 16 patients now in intensive care. Our normal capacity will be 13 ventilated patients. And we've gone into the operating theatres now, so we've got another 3 ventilated patients in the operating theatres.
Critics claim recent cuts to public health funding hurt Britain's ability to deal with a pandemic, and too few doctors are being tested for COVID-19. But Britain's National Health Service appears able to effectively deal with the coming peak in coronavirus cases, which some experts predict may occur over Easter. This may have condemned Spain to its worst health crisis in generations.
And it was a present for Saul.
67,000 people crammed into a stadium in the Spanish capital to watch Atletico Madrid take on Liverpool. 3 weeks after authorities knew of a coronavirus outbreak in Spain. A Spanish health official told the public the country would only have a handful of cases. Spain now has the second biggest COVID-19 death toll. Per capita, more than 4 times worse than China. And health workers say it may be much worse than officials are letting on.
Health workers are exhausted physically and emotionally because this is awful. This is an inferno. The numbers that I'm seeing on television are false. Why are they false? Because they are not testing people. We need to appropriate tools. We're always out of staff, and now suddenly we don't have enough jobs to post. Right now, there's no health worker who doesn't have a job. You should have hired them when it was still useful.
The pandemic laid bare Spain's systemic healthcare problems and authorities' lack of preparedness and general negligence. The crisis here is far from over. And it's only just begun in the land of the free.
This is going to be a rough 2 or 3 weeks. This is going to be one of the roughest 2 or 3 weeks we've ever had in our country. We're going to lose thousands of people.
The United States has more cases of COVID-19 than any other nation.
The Defense Department is now looking to procure an extra 100,000 body bags. Last week alone, 6.6 million more Americans filed for unemployment, and more than 90% of Americans now under stay-home orders.
And New York is ground zero for the US outbreak.
Waking up in the morning and walking into the hospital can feel like walking into the fire.
We're running out of medications, we're running out of equipment, and we're even running out of oxygen.
Our Commander-in-Chief has declared war on COVID-19, so it is a wartime footing that we're on, and we are treating this like a large military campaign.
The city's running out of room to treat the deluge of severe cases. Some patients have been sent to a temporary hospital in Central Park and a docked Navy ship.
They're anticipating that of all of these extra hospitals, including ones that have been converted from convention centres and other buildings, are just going to be jam-packed within a matter of days.
Lauren Few is infected but relieved.
I mean, I was just kind of like, whoa, that's crazy. And honestly, I was just sort of like, well, I'm glad I know and that I've been isolating just in case. I will say, like, the next day, I felt more anxiety about it. Like, when I was still coughing, like I was getting a little short of breath.
New York, California, and several other states have ordered lockdowns. Governors are fighting for federal government supplies and support.
Trump tweeting today that the federal government is only a backup for states and that the complainers should have been stocked up and ready long before this crisis hit. But governors say the federal government is now competing with them to buy those supplies, forcing them to bid against each other and FEMA.
I am asking healthcare professionals across the country, if you don't have a healthcare crisis in your community, please come help us in New York now. We need relief.
This, as the nation's second largest city, tells people to wear masks.
But when you have to go out, we are recommending that we use non-medical grade masks or facial coverings and not take the ones that are reserved for our first responders.
The US doesn't have a universal healthcare system. Americans' access to healthcare typically depends on their employment. US media have reported many people who may have been infected were concerned about medical costs and didn't seek help, worsening the outbreak.
I hope very much that out of this terrible, terrible tragedy, we do some fundamental rethinking about the nature of American society.
Getting the uninsured access to the care they need is a top priority for President Trump. We are already rolling out the $1 billion in funding from the Families First Coronavirus Response Act to cover providers' expenses for testing and diagnosing the uninsured.
Some have blamed Donald Trump for the scale of the current crisis. Critics claim the president was asleep at the wheel, that he implemented travel restrictions and sent federal aid far too late. They say he repeatedly dismissed concerns about a US outbreak as COVID-19 was ravaging multiple nations.
The virus that we're talking about having to do, a lot of people think that goes away in April with the heat, as the heat comes in. Typically that will go away in April.
Almost everybody that we see is getting better, and it could be everybody too. Now the Democrats are politicizing the coronavirus. You know that, right? Coronavirus. And this is their new hoax.
This was an unexpected, once in history event, and they got off to a rocky start, President Trump as well as the federal government. But they've since found their footing. More than half of all of Americans now approve of President Trump's job in handling the coronavirus crisis.
The coronavirus crisis could cost Trump his job. His biggest success as president has been in boosting the economy and employment. The pandemic has put pay to those achievements months out from the presidential election.
President Trump has an enormous opportunity to respond to this crisis, respond to it well, beat expectations in terms of the number of sick and dead, and bring the economy back to where it was. If he's able to do that, he will actually end up being in a stronger position.
The prognosis is bleak for the United States. Experts predict COVID-19 will kill hundreds of thousands of Americans. Doctors have warned they may not have enough supplies to meet demand, that they'll soon be forced to decide who gets treated and who gets left to die.
There are already reports coming out that that's already happening, that there are some people needing ventilators who are disabled or have a lesser likelihood of survival, who are being left alone for people who have coronavirus who are more likely to survive, because there are just so many numbers now. Look, it's scary. It really is. There's no two ways about that. The cases having gone from a handful to what they are now has happened so rapidly that it's really taken a while for, I think, most people to get their heads around the gravity of it. And to think that we're not even at the peak right now is probably, I think, the part that's really scaring most people, and also making most of them actually obey the stay-at-home orders. But look, nobody really knows what's going to happen, and I think that's the part that is most worrisome.
From the US to the UK, Australia to Zimbabwe, COVID-19 has spared no nation. Its impact made much worse by the Chinese government's deceit.
This is the first coronavirus pandemic the world has seen. It likely won't be the last.
We should start looking forward to understand how this experience is going to change us, or how it should change us, because this is going to be transformative. It is going to be transformative on a personal basis, on a social basis, on a systems basis. We're never going to be the same again.
We must learn the lessons from our failures. Thousands of lives may depend on it.
And I think what it highlights is that we need to think about elements of national coordination when you are responding to outbreak, alerting and enhancing your surveillance system early on throughout the country, activating all mechanisms that bring together a strong outbreak response.